In today's video, we're going to show you guys how to do sub-Q immunoglobulin. Sub-Q is subcutaneously immunoglobulin therapy. The reason why I'm on it is to help with my medical condition, dysautonomia, HOT syndrome, which is the malfunction of your autonomic nervous system. And so this is a treatment that has been out there for dysautonomia patients. Alrighty, so this is the setup that we have. This is my pre-meds that are right here. And how we do things is Robert uses the different caps in a certain way in order to know what is what. The 60 ml syringe, medication.
This is the bandages that after I put these needles in her, these are the bandages that I cover up because the bandages in here she's allergic to. It's Tegaderm, and these are more softer. What I usually do when I put it on, I'll show you them. This is what we use to keep it on her skin without giving her a reaction. Before you put even with the needles, I clean it with alcohol preps before, but I have not touching nothing until I show you how to set it up and how to put it on the person. This goes from these needles. This is 4. I'll show you what it looks like. This is the syringe version. There's bottled version, but we're going to show you later. That's the syringe. This is the adapter. I'm taking them out so you can see what they look like. And this is the other one. It's a 4 and a 2. So a total of 6. There's the syringes right there. You can see. These are the nipples you put on here to the 60 ml. And this is the machine, the infuser. What you do is you just turn this. They say all the way open. You don't really have to. As long as if you see that and you put it in with the syringe, you don't have to open it up all the way, but you can. You open it like this and never put the syringe in how they taught us, where they trained me. You never put the syringe with just the needles and then try to like push pressure, then take this off and put this on. Never do that. Don't go by the book. Follow what we do. I learned because they try to blame me at the place that trained me when the nurse went by the book and the medicine just squirted all over and she had to clean it up. But in the medical record thing online, it says it was my fault when it was her fault. She was going by the book. I don't go by books. I don't do it how I know how to do it. Books aren't always right. And obviously she learned, but she just blamed it on me so she didn't get fired.
Yeah, she didn't recommend it. She put my medical chart that it was Robert's fault.
So first thing, you go, before you set up any of this, you wash your hands with hand and I use Dawn soap, and then you put alcohol all over your hands, let it dry. Because if you put gloves on most of the time, even the sterile ones, the alcohol, if you still have alcohol in your hand, it'll pop the rubber on the glove and you'll have a rip in your glove. So we're going to start by step 1 right now. If you open up these, it comes in a package like that. That's the sterile glove. Here's the package I opened. I just didn't unfold them or touch them. and then you fold this. This is the left one, and this is the right one. The only thing that sucks about the sterile one, even though it says extra large, they're about large. And it's hard to figure out how to find the thumb. But you can also get these. You can buy these at Harbor Freight, because that's another thing they don't send you because of the COVID. Ever since COVID, they don't send you gloves ever. They'll send you like 5 sterile gloves to do all the stuff. IV, feeding tubes, and immunoglobulin. And they expect that to work for a week. It doesn't work. We buy these ourselves. We buy Metaplex Mortar. We buy Kevlar No Sting Barrier. The box comes like this. 2 of these boxes are $50. We buy this. They don't give us sanitizer no more. And I think
That's about $700 a month.
$700 a month. That's with the hand sanitizer. I get 99% alcohol, and I have a purple spray that sometimes, rather than using that stays like kind of sticky, I use 99% alcohol, spray my hands after I wash it with Dawn soap. Make sure you go between your fingers, make sure your nails and stuff. I have a pad that I scrub my nails and all over my hands, so if you have any dirt, then make sure it comes off. You dry it, don't touch the trash can. You have the ones that you put your foot on, throw it in the trash. Like me, for my trash cans that I use, if I go to Harbor Freight, get a 5-gallon bucket, and that's good enough for like the medical stuff. And then what needs to go in the sharks container, I have right here. I don't have the lid on, because I have another one that I put stuff in after I use this one that I have sitting over here. But we're gonna start right now. We're gonna be loading. I'll put on my gloves. I'm gonna get the 60 ml. I'm gonna take these. Each one of these go on each of these syringes. You don't reuse them ever. Then the next video after I do this one will be next week, or maybe on the same thing. We'll just put them all together. This is what I'm talking about. It's the hardest thing. And you don't blow on these either. You have to find the thumb. Make sure all because these stick. So make sure all these. Okay, now you can see where your thumb is. This is where the thumb is for the right one. So you're gonna go like this.
When you do it by IV, though, let me tell you that you grab it from the little pocket area and leave the pocket area how it is. You don't have to be super sterile with this, but we have to be for myself. And if you're immune compromised or an overactive immune system, like mast cell activation, POTS, dysautonomia, EDS, I have zero immune system. So we have to do the sterile. We do my line sterile, we do my feeding tube sterile, and we do the immunoglobulin sterile. Then things from the manufacturer, even though they're sterile in the past, have been contaminated. They've had recalls and stuff like that. Always check the expiration dates on your stuff too. Alright, so Robert's going to go ahead and set this up and put the syringe in. And
here's one of the
board showing.
Here's the 60 ml syringe. Okay, and now you open up seals on these. don't come off you. So what this basically goes on the other one, but I'm trying to show you guys little by little what to do. What I always do, just so all the whole meds come in, I pull it down to 50. Because what's going to go in is up to 30. So the air, like we'll say this one, this is how it looks. The syringe, the plunger is not in there. This is the plunger. You have to turn this on. So let's sit this down. Turn this on like that. Now, make sure you don't get this all over everything, because this is as thick as syrup, and it is really hard, even with like Dawn soap, to get it off you. Okay, I'm gonna take off this top. It's a rubber one. It's like real rubbery. So what I do, take it off. I'm gonna set it right here in the container. Then what we're gonna do is we're gonna get the air out first, so I can show you. There's a little bit of air. Get it as close as you can without the stuff getting on the outside. All you want is the bubble. You can see the bubble better in person, but when you first get it, there's a bubble right here. It's already out. This is where you usually put this red piece first, but we're doing it different. You can do it however you want. This is how you leave the syringe like this, it will go in, and put the meds in like this. This is not how it says by the book, but you don't go by the book. The book's not always right. Now, see, I use this for one of them. You don't use it again. The next one, or get the next brand new one out of the package. Take it, don't let it drop, hit the ground, nothing. Make sure it stays on the sterile thing. I put the new one on this rather than the syringe. This one is the one I just did is 4 ml. Okay, and this one is 2 ml. So it's a total of 6, and we do it on number 3 on the dial, which I'll show you after I get all the stuff that I have to do right now. So here's another rubber grommet thing, like a cap, but it's rubber. We're gonna put that back in the container. Okay, see, don't know if you can see in the picture, but there's air right there. You don't push that hard, because if you do, the meds will come out. But you can see the bubbles, so that's good enough. You can tell when the air is out of the meds, and you twist this on here, and then you're going to push this into here. Okay, now we're finished putting the meds in, so you take this off. The red stays on this. Put this back in the container where your meds are. This, they say leave air. I do not leave air. So, what you do is very slow. You go up. What air is in there, you can see the bubbles on the top. That's fine. That's enough air. Don't go by what they say and put so much air, and then it goes in on your arm or something, and then after you take off the needles, you have a big old lump. Okay, now this is the next thing that I do. These are Tagaderm, and people with allergic reactions or blister with them on, we don't use them. I throw them away. Now, with this thing I'm used to set the thread on the seal. So I'm going to set this thread with the meds right there. And we'll get some of this mess out of here. Okay, this is how they do the 2 needles. So what I do, you stay over the sterile field. You don't go over where it is not sterile, because this part is like very important to keep sterile. I keep my hands like this. See how the needle still safety is in there. Then I take this one off. Make sure the whole wrapper is. I hold it like that. Now, where I find the nipple part, make sure both of these are unlocked, which they are, because you can see they're moving. Both of them twist. If I left it like that, you can see both of them will move. We're going to take off, hold both of these just like this, because the first thing you do before you put the knob is you take this off. This is the cap. Okay? And before you even put it in the thing, go like this.
Sorry guys, it's so shaky, I'm trying.
You can't, you can barely see the air, but there it went. Okay, now what we do, so none of this touches anywhere else. You can't see on the thing with this small tubing of the air going through. I can see it like in person, you can see it better. Okay, then this, as soon as I find where okay, this has another top. Take this off, throw it right there, it doesn't matter. Then this part has a screw-on tip, but take that off, put it where your old stuff is. And what we're going to do is we're undoing this, screwing it in here, and then taking this is for the dial, and then you tighten. And that's basically, before I take off, and so what I do, let me clean up some of my mess right now. So I have room to stretch this out and clean it.
And you have to prime it, like you have to prime everything else just so you know.
These, if you could use them, use them. If not, throw them away like I'm gonna, because it's listed, especially if you don't have stuff. Okay, now the needles have a plastic on it. Here, I'll show you one of them. Let me untangle everything. So when I put it on her, it's not going to be tangled. So I'm going to set it separate, but just to show you, this is the safety that you take off. Pull this off. That's what keeps the needle covered with this and this guarding it, so you don't get poked in the finger. What I do, each single one, you lay it like that with the protectors, plastic protectors still on it. Each one, you know it came out of a package. This is what I do. I wipe the whole area. I wipe where these ones are going to touch her. And I don't take off the plastic. I'm going to I'll be taking alcohol squares to wipe the needle before I put it in and on her skin. But I make sure the plastic's clean. That's the first one. This is the second one. With different alcohol, take the white thing off again. This is the white piece that holds it. you get another alcohol. Then the other good thing about doing this is the meds that are in this don't get all over you until like after you like get the needle and put it on the patient that you're putting on. But I always clean the plastic before where the needle cover is. And you set it down again, a little bit before I start doing this. Now, the biggest part is what we're going to do, what I do all the time. All those are clean, so on the dial, you can see that arrow, it's at 6 right now. That's if I put it in the machine, it would go all the way to 6 and it would come out. This is what I do, I shut it off. Now, to show you, this is all what you have to do before you get the put it on the patient. You put it through the hole like this, turn it, and then that's why you don't have to do this all the way. But you
Don't they tell you to though?
They tell you in the book that you have to open it up all the way. You do not. Right now, no meds are going to go through the freaking needles. You set it down. All this wasn't tangled, but just the minute you sit it down, stuff gets tangled. So now I'm going to show you this. It's locked right now and it's shut off, but I'm going to unlock this so I can push this out of my way, and you can see on the small needle is that thing that's covering it. I'll put it closer. You can see it. Okay, what we're going to do is you take it off. The needle's behind right there. Okay.
It's tiny.
It's very tiny. And it doesn't matter if it came out of a package. I still get two alcohol things, because you've seen how somebody is even after they take a shower. You make sure you wipe it before you put it in there. Scan. Okay. Now, what's gonna suck? It's kind of nice when you have two people, but I'm gonna hold my finger right there.
Oh.
And it does hurt. Feels like you just got shot there.
Yeah, it stings really bad. Like when it goes in, you feel it, but it stings. Like it stings. Oh, getting stung by a bee. Normally, I'm helping him with this, and it's teamwork.
Okay, what I do is I take this, take that off, put this on. My fingers didn't get stuck with the knife. Then, also, I want to show you this. When you put it on the person, so I forgot to do one. What I do is I tilt that like this, so it's easier to take off after when it's time. With this Band-Aid, we don't need skin prep. This stuff, this is what you would use if you use Tagaderm, because it's only going to take an hour for all this to happen. Okay, now we need 2 more for the body and 1 for the needle. You don't touch this stuff that you hit right here. This goes away, and you just set it right here. So you do the same thing. We're going to do our skin on that other side. Well, you know what? Let's do it total kind of opposite. What we're going to do this time, we're doing this while we're holding the needle, putting it on her. We're going to take this bandage. It's called Metaplex Border. You take it off, set it right here next to the needle. We're going to go that. Rather than having so much trash, And we're going to take this, rip this open. Again, you're going to need 4 because you want to make, no matter if you take a shower or not, your skin always has dirt in it. So you really want to make sure. And when you put it in, you don't put it in the muscle. You can see she's turning red because she's already having a reaction. Like if you put it right here, it'll bubble up and then you have to massage it. So right here, under, they call it the bat. You put it on the bat and you clean good. Because when I'm going to put the needle, it's going to be, I say, it usually goes for about 45 to an hour. Or just making sure it's clean. And see, even though she took a shower, it's still dirty. That's why, even with this, I'm getting ready to put the needle again, but I'm going to do this early so I have it in my hand. And this is the other needle. Okay, we're going to unlock it. Pull the wings out. You pull the wings like this. You pull the little plastic cover that's on it, and that's how tiny the needle is. Well, even though it came out of a package, be careful. I wiped the needle, so how's alcohol? Now, when you put it in, you hold it like this. How the wings are down and you're holding onto the wings. Because after you put it in the skin, you let go and you grab that Metaplex border to put over it. It's just like a Band-Aid you could buy at Walmart, but it holds and it's not the adhesive isn't as bad as that Tegaderm. So we're gonna put this in the next one, next arm, and we're gonna give her more meds as soon as I get this put in, because I'm gonna start it, and you give her a little bit of meds during the whole time so she doesn't have a bad reaction. Now what I do, usually she helps me, but I'm trying to show you guys. I'm not that talented, but
I have the camera, so
I'm doing this to try to show you how, if you have your partner could help you, because not always they'll send you a nurse out, and it's not that hard that you can't have your partner, boyfriend, husband help you. It's easy. The hardest part is taking the needle off. Okay, now the needles are in, okay, and everything else. All this is, we could save. This stuff right here is trash. This is her pre-meds. Now what I'm going to do, we're going to give her I'm going to get Benadryl, but this is all we need right now.
Yeah.
So, we're going to set this down. Okay, now the beginning, this is how it starts. They're in her body. It's off right now, right? So now what her hospital provider told her to do is put it at 3. So we're gonna put it at 3. And this thing's all the way down. So you set it. And now what we're gonna do is give her some pre-meds.
You'll feel it when it first starts going in. It will burn where your needles are. So just to let you know, so you don't freak out.
And you take the air out of the syringe. This is a flush. And we're going to take these. One of these have Pepsid in it. And the other one has Zyrtec, I'm sorry. And that's what I'm going to give her right now to try to help her reaction, because she's turning red. And this is the one that we put it in, and then I'm going to be giving her probably Benadryl pretty slow. But you take this cap off, you take this, we're going to give her the rest of this one, because this is, and then every time you take your give meds, you don't use the same green cap, you always change it. Because that's like, if you use the same one, you might as well just not take a shower and use the same clothes. That's what it's kind of like. Now, that's the first meds, so we're going to just throw it over there to the trash. This is the first. This sucks. Good. I have two hands, but I already got the air out of it. This is the flush. We're going to do a push pause to get that flush to line. If you want to see what's the numbers, with Benadryl, you have to do it a lot slower. This one's just Pepsid, help the burning. Now, we're going to hang this here because we're going to put more meds. So what I'm going to do is just sit it right there.
Always leave the syringe on the end of this until you get your next syringe. You don't want the clay to touch your clothes or falling. If it happens, then you clean it again for 30 seconds. I usually get 2 squares and I scrub so you hear the squeak. It actually makes a squeaking noise if you do it hard enough to get the germs off. I'm sorry if this video I'm shaking, like I'm actually physically shaking. So I apologize if it's shaky.
If you were here, you would be able to hear it. I can feel it in my hand. It's like you're, it's almost for the guys, like, guys that don't do this kind of stuff. It almost like when you're sanding something. That's what it feels like. Okay, here's the next med I'm gonna give. I already got the air out of the flush. This one we're gonna do kind of slow.
Yeah. So besides Benadryl having to push it slow, you also push Pepsid slow. It can't handle going too fast. Their tech is usually, over a course of a few minutes. Well, all of them are basically. So there may be a time lapse in this, that I cut out some parts, but we're doing them 4 minutes. Push it, wait, push it, wait.
When you don't touch your face, you don't always have to have mask, as long as if you don't breathe on the fucking open wounds. Because I have problems breathing with the mask on. When I do her dressing and stuff, I have masks like what she has on, because the blue ones that they give you with the supplies make you start itching. And
really rough.
I turn red, so I don't use that. And the other thing, when you're giving meds, even though it's like this, we'll say this one, and all the other meds that I've been giving her, I never go all the way down. There may be meds right there, but there is also air at the very tip, so you don't not give that, push the meds all the way through. Then we're gonna do another, even though we're just doing saline, I would rather, for me, for my wife, and for the patient, I'd rather clean it again before you put, because you just put meds in. So clean right here, make sure the top. This is like time lapse, kind of doing it faster, but then you go like this, put this, and let's just push pause.
That's the medicine or a flush?
This is a flush.
Okay. So after your meds, you still do your flush slow.
And now we're set this here because I have green caps sitting right here. This Curo caps is what it's called. What it is, behind this little aluminum thing is there's a white, like, puffy thing, but I'm not going to take this off at this time. I'm going to finish flushing, but you pull this, and there's a white little thing with alcohol in that keeps
spongy inside.
I'll show you guys as soon as I finish flushing her line. I'm going to flush a little more, let it sit, and this stuff I've been giving her, her skin reaction is not as bad no more, but I'm still going to give her Benadryl. But I'm first doing this, and this is the very last thing that you do. Rather than putting this on and then taking it off and replacing another one, you leave the syringe on. Again, see, I leave that much on there. It's like 1 ml, less than 1 ml of this. Even though it's saline, I don't push it no more. Now, right now, I'm gonna go get the Benadryl, and she can tell you guys.
Alright, so he's getting my Benadryl. You can see on the top of my arm here where the flushing is, and it's there. I react to everything. I'm allergic to everything. I'm allergic to the lights. I'm allergic to people. I'm allergic to my own husband. I'm allergic to my daughter. I'm allergic to everything. In my head, I react. I drink, I react. My immune system is just sees everything foreign. That's why I'm doing this treatment, to try to help me with this, so I'm not so sensitive. My allergist even said she had somebody worse than me. I can't imagine that. Like, it's a blessing to know I wasn't her number 1, but I was her number 2 patient. I loved her until she retired. So,
Okay.
I should have did Benadryl earlier, but I had already had it. So, no, I can do it now because it's the time, but...
Okay.
Alright.
Okay.
I should have did Benadryl earlier, but I had already had it. So, no, I can do it now because it's the time, but...
Okay, again.
Alright, let me turn this around. Let me turn this around.
These are all pre-meds. This is Benadryl. This is Finnegan. So what I'm going to do is get the syringes with the saline, the air out of it before I start doing what I need to get rid of. I'm going to do one at a time so it doesn't get contaminated with any germs. And again, this is the flush, and I'll show you there's air right there. But even though you just did that, there's still air where the plunger is. That's why you don't go in further. So we're going to go give her Finnegan right now. I'm going to hold this because I'm not going to give her all of it. So we're going to give her a little Finnegan.
Make sure you dilute your Finnegan as well.
The Finnegan, I use one big still saline of saline to one bottle of Finnegan. Because if you don't, the Finnegan can give you like a skin reaction, or
and also you can get a movement disorder from it.
So okay, I gave her like 3.5 ml. So I'm gonna take this, we're gonna flush it, but this is for the whole, this syringe right here is for the whole time that she's getting her IG against it. SQIg. That's what I get everything ready before, time, so we're not keep on running around. So you guys are like, what are they doing? They're making me dizzy. So this is a flush from the Finnegan. I'm gonna give her, now when I give her Benadryl, it's gonna be a lot longer, but we have to do this, and you go by this, you won't have problems with stuff leaking. If you go by what the book says, you'll have medicine all over your whole kitchen table, wherever you're working, and put stuff on.
We've also just to note that in the past, we have had the dial leak on us.
Right where the tube goes in, the dial will leak.
Right here, right, baby?
Yes.
Okay, yeah, so it will leak. You have to just get another dial. It's happened to us in the past.
Okay, now this is Benadryl pre-made, diluted. You only put 1 vial per 1 bottle of sterile saline. So if you give too much, it can make the patient hallucinate. They could have nightmares, heartburn. See, I'm gonna go just to the 7. I don't, and that's it. And then when you're flushing this, you don't go, you go real slow. If you push fast, the person's gonna have like
bad side effects. Oh my gosh.
So what we're gonna do for now, I'm gonna use this just to hold the meds because I know what it is. I'm gonna set the meds right here. This is a flush that while I was getting other stuff ready, I took the air out. Now we're gonna just push pause and slowly, because this is Benadryl. And when I'm done flushing this, I'll show you what's behind the Kuros cap. It's right here, and these are expensive when you have to buy them yourself if your provider does not give them to you. And also, just so you guys see it too, see this, see that bubble right there? I've never let the meds go totally through. I let it go to about 5, and I shut this thing off and take the needles out. And then I clean her arm again, because of that bubble that you can't get out, because if you get more of the air out, then it gets all over this, and wherever you're working at, where you're laying your stuff and everything, it'll feel like you have you put Karo syrup that you make fudge with. It feels like you have that all over your hands. So when this gets down to about right here, that's about 5 ml. See, it's 10 right now, but when it gets down to that big line right there, I shut it off. I don't give it to her because I don't want none of that air. That's why you lay it a certain way. That's why the bigger part, like right here, the bubbles are right here. When they're up, what you can do too is go like this to make sure when your meds are coming through, the bubbles stay right here. There's like 3 bubbles right there, just so the bubbles don't. If you want to zoom in, you can see they're like 1 big bubble and 2 small ones. That's better to have it that way than when it gets down to the 5, about the 5, because it's at a little above 10. So when it gets down to the 5 mark, I open this up all the way and shut off the dial, and I get more alcohol that I have already and get her so she's cleaned up. And then if there's any bumps, then I rub them out, which I use. I'll show you after I finish this. something else that you can buy that helps. But I wipe her arms with corn huskers. Corn huskers after I wipe it with alcohol from the treatment, so it's not like raw. Now, for what I could show you now, I just flushed that all this whole time while we're talking. We're going to take off this little thing. There's a little sponge, and it has alcohol in it. Okay, so now we would take off the flush, and see, I didn't even do the whole flush on this one. When you put this on, you hold it, and you turn it, make sure it snugs. Then you come up here. I do not like what they do normally at the hospitals is they put the clip all the way down here. It's better to keep your clip up closer to your dressing, because if you put it down here, then the manufacturer defect, it starts leaking from right here. So it's better off not to clip it there. So we're going to wait for her meds to finish. While I'm doing that, I'm going to drink and get more flushes and alcohol, so we can get this to finish up what we're doing. Okay, after I take out the needles and wipe her skin with alcohol, because there may be some of the meds that get on the outside, it's sticky. I put this is like the old school, like your grandparents, everybody used to use. Well, this is what I put on her arms after. Rub out if there's any bumps. So now that's how you do the setup. Well, we're going to end the video with this, but this is a good thing. So if you have dry skin too, this is better than the lotion that you can buy nowadays. Go on Amazon and buy this. Buy like five bottles. It'll last a while. But like with all the alcohol and stuff, this helps your skin stay real moist. So we're going to roll the outro, and that is how you set up and give the meds to your patient.
Hasta for now.
Have a nice day.
Have a nice day.
And that's our tutorial on subcutaneously immunoglobulin therapy. Make sure to like this video, follow us, subscribe to our YouTube channel, and remember, sharing is caring. Find us on Facebook, and we'll see you in the next video. Let's find